So what is a breast reduction? Who is a candidate for breast reduction? What happens with the breast reduction? To know more about breast reduction, you should watch this video. Hello everyone, welcome to today's topic. Today we're going to focus on breast reduction. So let's going to put on the board breast reduction, and as the word says, it's basically a surgical procedure where we try to reduce the size of the breasts. The ideal candidate, or those patients who we think, or those people we think can benefit from such a procedure, are usually those people who have large breasts, and these breasts are symptomatic. They tend to cause them certain problems, and these might include neck pain, back pain. They sometimes have like skin infections or skin problems just below their breasts at the level where there's what we call the inframammary fold. So they have skin, maybe infections. They also have problems with, for example, physical activity. They try to run, or if they go to the gym, the weight of their breasts might have sort of keep them from doing some of those physical activities. So sports they can't participate as well as they would. If they went to the gym and they have to run, they can't do that as well as they would. So some of that can also sort of point towards the need for you to have a breast reduction. So physical challenges could be at the gym. It could be your usual morning jog. If your breasts are impeding that activity, then I suspect you might benefit from a breast reduction. Then also, if you have problems getting the right fitting for your breast, you go to the boutique or the shop store. You've gone to buy your bra, and you find either they can't find the size of your bra, or it's just if they do find it, it's just too big, and you find that you have fitting challenges for your bra, for your breast. Then odds are you most likely need a breast reduction. So most times your patients who have these really huge breasts also have some sort of psychosocial impact that it has on them. Because the focus, when they go to most of these social activities, people might put a lot of focus on their huge breasts, and these might have a negative impact on their well-being, and they might be very self-cautious of the fact that they have these really, really big breasts. And once they have that psychological impact because of the weight of their breasts, and then they have some of these symptoms as well: the neck pain, the back pain, the skin problems or infections just below their breasts, maybe physical challenges. They can't get a good jogging in the morning or in the evening. They have challenges playing sports. They have problems getting the right fitting bra or even just the right fitting cloth when they go for a party or a dinner or any other social event. Then chances are you are a candidate for breast reduction. So what actually happens during a breast reduction? So we're trying to move from a large breast, so it looks something like that, and we're trying to move towards something like that. So we've reduced the size of the breast, and if you noticed, we've also put the nipple or areolar complex in the rightful position. So the two key things that usually happen with the breast reduction is we reduce the size of the breast, and then we also reestablish, or we replace the nipple areolar complex in the rightful youthful position. So that of course has to be differentiated from a mastopexy. Mastopexy just repositions the nipple areolar complex, but a breast reduction reduces the size of the breast, then at the same time we also reposition the nipple areolar complex. So there are certain things that your surgeon must have, certain discussions that you must have with your surgeon, because to move from this to this, certain things have to happen, and there are certain things that you need to think about. One of those is the scar. Because reducing the size of the breast, and then we're also repositioning the nipple areolar complex, the scar is very important. You might have a scar that runs from the nipple areolar complex that runs all the way down to the inframammary fold. So you might have a scar that looks like an inverted T. You can see the T here, the inverted T. And that's really important to think about, because that means that there's always a risk of having scar problems after the breast reduction. So things like scar problems is something that should be talked about. This scar can be hidden, the one that's at the bottom of the breast, but this one is clearly visible. The other thing is the breastfeeding, because some of the common questions that we get when this procedure is going to be done or is planned is, will I be able to breastfeed? And I usually tell patients that because it's hard to tell, especially if you have not breastfed before, whether there will be an impact that the breast reduction surgery might have on the breastfeeding issue. But odds are, because you do a lot of cutting within the breast tissue when you're reducing it and repositioning the nipple areolar complex, there's always a risk that the odds of breastfeeding, either the amount of milk might reduce, or you might not actually breastfeed your child after you've had your breast reduction. So breastfeeding problems is something that must be talked about as well with your surgeon. The risk of you not breastfeeding is actually there. The other thing to have a discussion about is sensation to the nipple. Because we have so many cuts when you're moving from this to this, we try to get this nipple from where it is way down here. We are repositioning it all to a more central position. The number of cuts that we make can be significant, and then injury to the nerve that supplies the nipple areolar complex is possible. And you might find that you might lose a bit of sensation to your nipple areolar complex, but most times that tends to come back over a period of time, maybe 6 to 9 months. That sensation should be back in case the injury does happen. So one of the risks that can happen with a breast reduction surgery is you could have injury with that nerve that supplies your nipple areolar complex. The other chart that must be had is in regards to symmetry, because remember, you are trying to reduce both breasts, and so you're trying to get them to look as alike as possible. And we all know that for most ladies, there's a certain degree of asymmetry that they already have with their breasts. But when you come to me with the large breasts and you need a breast reduction, some of the things to think about is that you could have that asymmetry still there after the procedure. But I always insist that, when the surgeon goes in to try and reduce the breast, they're trying to achieve as much symmetry as possible. The other thing that could be discussed as well, which can sometimes happen, is infection, bleeding. This could happen during the procedure, but of course now we live in a time where bleeding isn't much of an issue, especially during the procedure, because now we're able to arrest the bleeding during the surgery. But after the surgery, it can actually still happen. You could find that maybe during the procedure the blood pressures were a bit low, but after the procedure maybe the blood pressure goes up a bit, and some of the clots that were there, maybe the blood vessels open up. So bleeding then becomes an issue in the post-operative period. And once that happens, what forms what they call a hematoma, which is basically a collection of blood, and that can easily pool within the breast, and that can also have certain other consequences. So bleeding is something that could happen in the post-operative period, and it's a discussion that must be had with the surgeon before the procedure is done, as a possible complication, as something that can actually happen in the postoperative period. Then you have things like infection. This can usually happen, especially as the wound is healing. You could have like wound healing problems. You might find like maybe after we have made the cuts, we've reduced the size of the breast, and now we've put everything back together. There's always a risk that because of the reduced amount of blood supply in certain areas of where we've done the repair, you could get like a local infection happening there, and that might actually cause that area to open up. So that is a proper risk that that is possible with patients in whom you've done a breast reduction surgery. So I would say these are, the most common things that the surgeon will most likely talk to you about before you have your breast reduction surgery. So it's important for the patient to have an idea on these basic things before the operation is done. Thank you.